Medical emergency. Good morning, this is Yolanda. Medical emergency policy. A medical emergency will be assessed by associates. Number 1, depending upon the severity of the emergency, outside assistance may be required obtain. When in doubt, outside assistance will always be utilized. Procedures: for immediate outside medical attention, telephone 911, paramedic/ambulance. Number 2, associates at medical incident situation. Letter A, provide immediate attention and basic first aid. Remain with injured ill person until otherwise directed by individual in authority. Letter B, under procedure, if medical care is needed beyond the first aid ability to associates, the following appropriate actions should be taken. Under B, telephone 911, paramedic/ambulance. And letter A, under 1, provide immediate attention and basic first aid. Number 2, attempt to contact parent, guardian, and or residential service provider. Number 3, attempt to contact emergency contact listed on application if parent, guardian, residential service provided are not available. An occupational accident, injury, or illness report or a special incident report must be completed by responsible parties. This complete copy of Mr. Seal's injuries and illness prevention plan is available through supervisors. The next one, seizure. Seizure known who is likely to have a seizure. Whom in your clients to have a seizure, you have to know it. Find out if anyone you support has seizure. Identify what the characteristics of their seizures. For example, do they fall to the ground or just appear to daydream? How long the seizures typically last and how often they have seizures. Know the triggers. In some cases, there are triggers that can cause a seizure. Some of these are lack of sleep, exposure to extreme heat, fatigue, poor nutrition, menstruations, stress, and missed medications. Be aware of the triggers for each person. Do your part to minimize these factors. During seizure, remain calm. Take steps to prevent injuries to the individual. Protecting the individual from nearby hazards, loosening the clothing around the neck, placing something under the head, turning the person on the side, time, the length of the seizure. Do not put anything in the individual's mouth. Do not attempt to restrain the person. Observe the characteristics of the seizure. If seizure lasts than 5 minutes, call 911 immediately. After the seizure, the individual for any check. Okay, let's see. After the seizure, check the individual for any injuries. Call your supervisor and report the seizure as well as the characteristics and length of the seizure. Observe the person for disorientations or signs of additional seizure. Thank you.